Welcome back to another episode of Quick Hits, where we sit down with the leaders shaping the future of healthcare IT. I'm your host, Tyler Smith, and today we're joined by someone whose impact on innovation and digital transformation is felt well beyond his organization. We're thrilled to welcome Dr. Luis Taveras, Senior Vice President and Chief Information Officer at Jefferson Health. Luis brings a visionary approach to technology modernization, operational excellence, and patient-centered digital strategy. His work has been instrumental in guiding one of the country's most dynamic academic health systems through change and growth. In today's conversation, we dig into what it really takes to lead transformation at scale, the future of data-driven care, and the mindset CIOs need to navigate an increasingly complex digital ecosystem. Let's jump in.
Well, welcome back to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by Tyler Smith. Tyler, how are you?
Fantastic, Ken.
Good. We've got a great guest today, Dr. Luis Taveras. He's the Senior Vice President and Chief Information Officer of Jefferson, which is a large organization. Really excited to have you on the show. Welcome, Dr. Taveras.
Thank you. Thanks for having me.
Yeah. To start, we're hoping you could share a little bit about your journey into healthcare IT and what exactly brought you to Jefferson as the SVP and CIO.
Wow, I got to go back a long time here. So I started in healthcare IT back in 1987. I was at IBM at that time, and we decided that we were going to cover all healthcare in the state of New Jersey with one team, and that was my team. So that was my entrance into healthcare IT, and I've been in it since then. I've been the CIO for the last 25 years. My first CIO role was at St. Vincent's Catholic Medical Centers in New York City. And unfortunately, we had to go through 9/11 as the closest trauma center to the Twin Towers back then. Since then, I've been the CIO at the different healthcare systems throughout the Northeast and ended up coming back to Jefferson through Lehigh Valley, became the CIO for Lehigh Valley Health Network. And then we merged with Jefferson on August 1st of 24, and I became the CIO for the entire new Jefferson enterprise, which is comprised of three different lines of business. We have the Jefferson University. We just celebrate 200 years as a university in the city of Philadelphia. We have Jefferson Health Plan, which really focuses on Medicare and Medicaid members in the state of Pennsylvania. And then we also have Jefferson Health, which is now the 15th largest healthcare system in the country, with 32 hospitals across Pennsylvania, Eastern Pennsylvania, and South Jersey.
Wow, congratulations. That's what an accomplishment. And then just to hear how large Jefferson Health has, or the Jefferson organization has grown, congratulations. And no doubt you've played a great part in that. Jefferson Health is known for its innovation, especially in care delivery. What have been some of the most impactful technology initiatives that you've led or overseen in the last couple of years?
So in the last couple of years, we really have focused on bringing the two organizations together, Lehigh Valley Health Network and Jefferson. It's really almost a merger of equal. So it's two very large organizations coming together with lots and lots of different tentacles to put together, especially the network and all those different things. And some of the things that we've done are probably very mundane, not very exciting, but absolutely critical when you bring a system like this together. For example, we focused that first year in saying, one of the things we have to do is to make sure that we have one single email system. Much easier said than done. But in 9 months, we were able to do that. And the importance of that is really think about having to navigate two different email systems and doing all that. And you don't feel like the same organization. But once we flip the switch and we're on jefferson.edu for our email, everybody logs into jefferson.edu. from a cultural perspective, from an organizational perspective, that's a big step, not just the technical side, but also what it means that now we're all logging into the same email system. What impacts that has on the organization is very large. So it's things like that that we've done, tying the two networks so that we can trust the network, so that we can have the same security levels across the entire network. That's very big for us. So it's been those type of things that we've been tackling. Of course, we have a lot of AI things that we're doing, as I'm sure we'll talk about, right? But those are the basic big building blocks that we have to put together to bring these two large organizations together. And that's what we've been focused on. Also building the culture, right? Making sure that we have one culture across all Jefferson. From the IT side, we accomplished that really quickly. I would say within 60 days of coming together, there was no us and them anymore. It was one team supporting the entire Jefferson enterprise.
Dr. Taveras, that's fantastic to hear how not only the technology has become unified or the infrastructure, and then also the culture. Obviously, that's what everyone says matters more. And I will say the fact that you started in healthcare IT when I was born is, or maybe a year after I was born, is fascinating because I've met you a handful of times at conferences, and so I'd almost want to ask you the secret to looking so youthful. But I know that's not the point of this podcast. So yeah, as we talk about the merger a little bit more, the complex IT and cultural challenges. Also curious about how you all approach data migration and system integration to create like the unified digital foundation.
So when you look at these two behemoths coming together and you count how many applications we have, you could imagine that we're well over 1,000, right? When you think about that nightmare that creates from an operational perspective, financial, everything else, we can't have 1,000+ applications running this organization. So the focus is right from the beginning. What do we do from an application rationalization perspective?
Right.
How do we get to the 350, 400 that we really need to run the organization? So we put a lot of effort into the application rationalization effort. And now we're going to the next level, which is how do we do the rationalization of the infrastructure that supports those applications? So not just the systems, the servers, and the migration to the cloud that we're going through, but now thinking about cyber. What are the cyber tools that we use? How do we protect the organization on a daily basis? Because people ask me, what's your number one job? My number one job is protecting this organization. We have to make sure that we're safe. We have to make sure that we stay in lockstep with the cyber criminals across the globe that are trying to hurt us in any way they can, many, many times a day, right? So that's my number one job. But really building that infrastructure, you mentioned data. We're still going through that. Data synchronization, creating an enterprise data warehouse, it's a major focus of us, especially if you're going to get into AI, the way we're going to get into AI. We have to have a pristine data environment to drive that and to really get the benefits and the value that we expect from these investments that we're making in IT.
And that's a great segue. So benefits and the value. You talked about, how the merger has gone so far. But as you look forward, what does the Jefferson and Lehigh Valley Health combination mean for the future of the combined health system? And I know you've alluded to some areas, but maybe if you can just paint the vision for us.
So there's nothing that we do in Jefferson, any line of business, that doesn't depend on IT. That's just a fact, right? Whether it is the real cutting edge, innovative things that we're doing in the clinical space, to all the things that we're doing to drive the efficiency and the productivity of every member of the organization. We have 65,000 colleagues across Jefferson. Every single one of them depends on IT to do their job as well as possible and to provide the best outcome possible for our patients. Because at the end of the day, that's our major focus, our patients in the communities that we serve. So there's lots of things that we're doing to make sure that we get to where we have to get. And IT plays a major part. And the way that I make sure everybody looks at IT is, in the old days, certainly when I started back in the 80s, the focus was on IT just to provide automation, to make sure that we did the best we could with the lab system, the radiology systems, all these different departmental systems that we put together. Nowadays, we're well beyond that. where we're looking at how do we optimize what we do in every single department with every single person that we have across the organization. And we play a role in that. And I make sure that our team understands that we are a services organization and that we're here to support every part, every member of the organization to do their job as well as they can. The other key focus is we used to think of IT as a cost center. Absolutely not. IT is a value center. The organization chooses to invest in us and the IT solutions that we provide, the IT environment that we create. But that's because there's expectations that when we make that investment, we're going to get value back. So very, very focused on what's the value that we bring to the organization. We don't do anything without having a business case for doing it, because we have to show what the ROI or the soft value is that we're going to bring to the organization to move us forward.
Yeah, I love that language of a value center, and I will be sure to borrow that one.
Dr. Taveras, you've talked about just having the right perspective, but if we could dive in a little bit to the strategies, right? So what strategies do you have in place that ensure the patients and the clinicians really benefit from the seamless care that you're creating when you bring these two massive systems together?
So the way that we operate today is Lehigh Valley and Jefferson, mostly in the Center City, Philadelphia area. We are obviously one organization, but we still don't have a lot of patients that are going across. Right? We still have a lot of patients in Lehigh Valley and in Philadelphia. But as we move on and do the clinical integration that we're working on, we will have more patients that will go across. So we have to make sure that we take our two Epic environments and figure out a way to bring them together so that from a patient perspective, from a clinician perspective, they have no clue that we have two different systems in the background. And that's really the focus for everything that we're doing, which is make sure that our end users, whether clinicians, whether operations, financial folks, that they get what they're asking for without worrying about what's happening in the back. And I use the analogy of a cruise ship. If you go on a cruise, you want to stay on that top deck with all the luxury and everything that you have. I don't want you to worry about what's happening in the engine room at the bottom. Right? It's the same analogy that I want to have in the IT environment. You say what you want to do. You want to look at this patient record. Ask for that patient record. Don't worry about how we're getting to you in the background. It may come from the Epic environment at Jefferson. It may come from the Epic environment on the Lehigh Valley side or somewhere else. But I don't want you to be exposed to that. We want you to be completely opaque to that environment that we have in the background. I need to serve to you what you're asking me for. And that's really strategic where we have to go. Are we there yet? No, but that's exactly what we're going, and we're making great, great progress in getting there.
Yeah. So as you continue to evaluate, obviously, I'm sure you're coming up with new strategies in order to deliver that seamless experience. So we hope to follow up on that in the future as you continue to hone in on that.
Sure.
You mentioned security earlier. With larger networks, obviously comes much greater risk. So how are you thinking about the cybersecurity and the compliance as Jefferson grows through each merger? What's your strategy there?
We have a major investment in cybersecurity. I have the luxury of having a very large cybersecurity team, and we can have a red team, white team, every kind of team that you want to make sure that we do the right thing in supporting the organization from a cyber perspective. The other thing that I do that may be unique across a lot of CIOs is my focus on cybersecurity is increasing the level of education and awareness of every single one of our colleagues, but also making sure that everybody understands that cybersecurity is not just an IT function. It's not just my responsibility. It's the responsibility of every single person across the organization. And I want to make sure that I hold them accountable for that responsibility they have. And therefore, I implement the program pretty much everywhere that I've been, which is to hold every single person accountable for cybersecurity. Some people have described it as draconian, but it's not draconian when you have gone through a process and where you've been attacked and you suffer the consequences of that. So the way I put it together is that we spend a lot of time, again, on education and training and awareness. But at the end of the day, I want to, again, hold people accountable. The way we do that is we have a program where I call it three strikes, you're out. We send you fishing exercises. If you fail three fishing exercises within 1 year, then you represent too much of a risk to this organization, and we can't afford to have you around. So we do everything possible when you get a first strike, when you fail the first one in terms of training. We do even more when you have two strikes, because at that point, I have to make sure that I protect you from yourself in terms of getting the third strike.
Mhm.
So it's a very focused program. It takes a lot of time to implement, and it takes a lot of education and training for the organization to know what we mean by the accountability model and what their responsibility is. But it sure works. It sure works. We go from 5% of people failing these monthly fishing exercises to well under 1% of people failing after we go through this process.
That's fantastic. And it's funny because I've been watching a lot of medieval shows recently, and I just keep on thinking about like what you're saying. It's like those fortresses back in the thousands of years ago. It's all dependent on, it just takes one person at the watch not paying attention, and then the entire fortress is potentially under siege. So definitely appreciate the need for everyone to be vigilant. We started the conversation. We talked. You mentioned data warehouse for a second, and obviously now you all have a treasure trove of data, and it's only going to grow. And just wondering how you're using the data, or you plan to use the data and analytics to improve clinical outcomes, operational efficiency, and/or decision making.
I mentioned culture before too, and this is a part of that culture. So what we need to build is a data-driven culture where every decision that we make is based on data and analytics that we provided to our staff. So very, very focused on making sure that we harvest all this data that we have and really convert it into valuable information that we use to drive the organization. We're getting there. We had done quite a bit of that on the Lehigh Valley side before the merger, and now we're making that happen across the entire Jefferson enterprise. So we have a set of dashboards that we call the active management dashboards. And those active management dashboards is what every single leader across the organization looks at first thing in the morning to see exactly what we said at that time and drives the decisions they make throughout the day. So very much of transforming the culture to make sure that we base that what we do and how we do it on the information that we provide. And again, now we're going to have AI. We're going to create agents. We're going to do a lot of these things to make that even easier for people. But it all goes back to the data and how pristine the data environment is and how much trust. We have to get people to trust the data that we provide to them. Whenever we have a solution that provides an answer that people don't think is correct, right? You lose a lot of trust. And that's absolutely critical for us as we migrate into this culture of a data-driven culture.
For sure. And I remember, in the 2010s installing population health platforms, and, if these dashboards are released too early and the data isn't pristine, like you mentioned, and the decisioning then comes into question based off the data, then the trust is very hard to rebuild. So totally understand your appreciation of ensuring that the data is pristine and that the end users have full faith in the outputs, if you will. Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure, so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now back to the show. Shifting gears a little bit, moving from maybe what we might call a little bit behind the scenes to the patient, I will say that somewhere, probably in Becker's or one of these publications, the next generation, the Gen Z, really values the interactions that they have with the more of the digital front door or with, the apps, and that drives, how they're going to consume healthcare. So wondering like the new technologies, whether it's AI, automation, or other patient-facing digital tools that you're most excited to explore at Jefferson in the next few years.
So our number one focus at Jefferson is really driving access in any way that we can. And you mentioned the digital front door. That is the preferred method for a lot of people these days. So we are investing significant time, effort, and other kinds of resources to make sure that we have an open digital front door that they can come through, whether that's through website, whether that's through us reaching out to them with Epic solutions that we have, Hello World, Cheers, and all these different solutions that we have. We have to make sure we make it easy for our patients to come to us and to interact with us when they come to us. We have some very innovative things that we're doing. Over a year ago now, we opened work on a Hahnemann Center in Center, Philadelphia. It's a medical office building, but not your traditional medical office building. It happens to be a 19-story medical office building. So we put a lot of technology in there to make sure that when the patients come in, they go to a kiosk and they register through the kiosk, and the kiosk will say, go to room 1505, for example. When they get to 1505, they go in there, the nurse comes and does the visit with the patient, and then the physician comes in to do the visit with the patient. At the end of that, the physician is done. They press a button, and up on the screen comes up somebody to check out the patient through a virtual checkout process that we've created. So the patient does all the appointments that they have to set up and any follow-up they have to do. They complete their work with the virtual checkout process, and then they go and leave. So they don't have to stop at a desk. They don't have to be asked a ton of questions. We want to make it that simple for them throughout the entire organization so that they have this seamless interaction with us and make sure they have a great experience from the beginning to the end with us. So major focus on access, major focus on creating solutions that make it easy for patients to interact with us, whether it's a virtual visit, whether it's a virtual specialist visit. All those are the type of things that we're doing to, again, make sure that the patients come to us and they have a great experience with us.
Yeah, fantastic. And I can really see, as you painted that picture of that tower, can see these workflows happening. So really, really cool to listen to that. Would love to see it at some point too. Maybe not as a patient, but as an observer. But congratulations on what you all are building there.
Yeah, it's been great because we've had a lot of other systems come and say, how do you guys do this? So a lot of people want to emulate what we've done.
Yeah, I was about to say, it almost seems like the value center could become a revenue center if you started marketing that, but I'm sure that's a conversation for your board.
Yeah.
Dr. Taveras, earlier you talked about the challenges, right, of merging, and you mentioned the importance of having one culture. So while there might be one culture, you still have IT teams and clinical stakeholders across the organization. So how do you build a culture of innovation and collaboration between those two teams in such a large and growing organization such as yours?
There's certain things that I do to make sure that we build that culture. That culture has to be built on lots and lots of continuous communication, and as you mentioned, collaboration. So what are the things that I do to make sure that happens? Number one, I have a daily service review call. So 7:30 in the morning, the top 25 or 30 leaders within an IT organization were on the phone. Because by 8 o'clock in the morning, not only do I need to know what's happening across the organization, but I need every one of those leaders to know what's happening across the organization. It's amazing how well it works to build the level of teamwork that we need to start building that culture. Many times when we get together at 7:30 in the morning, the first voice that we hear is each other's voice. And we don't log in at 7:30, we log in at 7:22, 7:23, and then we have a lot of chit-chatting that happens before the actual meeting starts. That really, really helps us cement the team and to have people get to know each other the way they need to know each other to work well together. So that's one thing. The second thing is I have a 2-hour leadership meeting every week to make sure that that we share everything that's going on. By the way, on the daily service review, sometimes it goes as fast as 5 minutes because everybody says nothing to report. There's nothing happening. But if something is happening, the resources that you need to make that to address whatever is happening is on the phone. So we quickly jump onto a situation or say, I'm going to help you with this when we hang up, right? So that's critical. One different that happens on Fridays. So Friday, I call it Celebration Fridays. So on Friday, not only do you say nothing to report, but I want to thank such and such for something that they did for me this week. We work with our colleagues all the time. There's got to be somebody that did something special for you that week that we celebrate. So we make sure that we celebrate people every Friday. And when the report comes out after the call, all of our colleagues are looking to see who got recognized this week, right? So that's the kind of environment that we want to create and build in that culture. I started to talk about the leadership meeting, and that's critical because we have so many things going on, if you would imagine, right? And we have to make sure that we're well aware and well coordinated in what we're doing and how we're doing it. So that's the purpose of that leadership meeting. Once a month, at the last meeting of the month, I invite the directors and up, not just my direct leadership, but I invite a larger group so that they hear what's going on a monthly basis. I also hold 2 meetings a year that are in person. As large as we are, we do that. Because I need people to continue to work and interact with each other and get to know each other. I'm probably one of the few CIOs that has brought the team back to the office. So I have the team in the office 2 days a week, and that's absolutely critical. It's just impossible to build the culture that I want to drive and build while having people on the screen. It doesn't work that way. So it's absolutely critical that we're back to the office, that we're interacting the way that we interacted in the past, and that we're really sharing. You'd be amazed at the discussions that happen, the solutioning that happens after a meeting as you walk back to your office, when you're in somebody in the cafeteria. All those type of things are absolutely critical to building this culture that we're trying to drive, which is really a high performance culture. That's what we're looking at. We want to be the best of the best out there when it comes to the IT organization, supporting as large an organization as Jefferson.
You mentioned a couple of different things, really great takeaways. That daily touch point, that weekly leadership calls, and then like the celebrating one another on Friday. I think that's great examples of leadership and building a culture. Talk to me just a little bit about the challenges with the return to office. There's been a lot of organizations that have done the return to office and they found people are resistant. How have you been able to, well, one, how was that taken by the team? And you mentioned like what the benefits they have, but was that a hard sell, or were the benefits immediately apparent?
No, it was a very hard sell. People got very used to working from home, and it is a major change, right? So we have to make sure that we understand and appreciate the fact that it is a major change for the way that people have worked in the last few years. But my message initially was fairly simple. If I was here 7, 8 years ago, and I said to the team, guess what? Starting next month, you only have to come to the office twice a week. I would have been treated like a king, right? What a great thing, right? And now I'm asking people to come back 2 days a week. And I know that it's a hardship, but it's something that we have to do to make sure that we build this team. We have to make sure that we accommodate people with their personal lives, so that we make it as easy as possible for them to do it. But it is critical to me that we have that in-person work environment.
Well, congratulations on finding a way to balance the needs of the organization as well as the personal needs. You don't often hear that consideration when it comes from leaders. So that's really awesome.
One of the things that happened when I proposed this and started working on this was, oh, you're going to lose so many people. We lost almost nobody. I can count
Nice.
in one hand the people that we lost because of the return to office.
I think that says a lot about the culture you had already built, right? So to find people were willing to kind of follow your vision, that's awesome. If you look 3 to 5 years ahead, what's your vision for Jefferson Health's digital future? And then where do you see the biggest opportunities for transformation and growth?
It's all about AI,
Mm.
right? And the adoption of AI. So we are very focused on making sure that every single member of the organization knows what AI is all about, understands the value that AI can bring to the way they do their job, and how it maximizes what we do as an organization in terms of having the ability to create the access that we need to create and create an environment that's going to generate the best results for our patients. So it's really focused on that. And we are at the beginning stages of the things that we can do with AI. But we're going to be very, very aggressive in the next 12 to 18 months in making sure that we roll out all the possible solutions that are out there for the organization. One thing that I want to be really careful with is what you see happening in the industry right now. When I went to a conference 2, 3 years ago, there were lots of people displaying their solutions and talk about their solutions. All of a sudden, when I go to a conference now, those same people now have an AI solution. How do they magically go from the solution they had traditionally in the past to now AI solutions? So we have to be really careful about what real AI solutions are out there.
Mm.
The other thing that I really caution the organization is let's make sure that we look for AI solutions based on our strategic plan and that the AI solutions actually meet the needs of something that we need to address. Don't let the vendors dictate what our solutions are going to be or generate the interest, because otherwise we're going to be inundated and not able to focus on what we really need to do as an organization.
Excellent. Well, Dr. Taveras, thank you so much for your insight. We appreciate just hearing about your leadership style. One of the things that I wrote down is when you said cybersecurity is not just an IT function. I think that that's a great perspective to have, and clearly you're having success with it. So congratulations again on all your success. Any parting words, Tyler?
No, this has been a fantastic conversation. And Dr. Taveras, I've been able to see you speak on multiple panels over the years, but really getting to know you a little bit more over this conversation has been something I'm very grateful for, as we move into this season of gratitude. So thank you so much for your time.
Thank you, folks. And I do want to do one last plug, right? I
Yeah.
have a book out there called The 90-Day CIO. I wrote it because I wanted to share with other CIOs and other folks in IT all the things that I've learned. I said, wait to pass it forward because I've had so many people that have helped me in my career, and I want to pass it forward to others. And by the way, all proceeds from that book go to charity. So that's just a great thing that I want to share with everybody.
Love it. Yeah.
Excellent.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.